So here we have a little girl who has an internal rotation in her lower leg. You can see that the dot is in the middle of the knee with the knee internally rotated. And in that position I can internally rotate the lower leg or the tibia bone on the femur to about 90 degrees, and I can externally rotate the tibia bone on the femur only to pretty much straight ahead. So there is tightness of the three muscles, the muscle that comes across the thigh called sartorius, muscle that comes through the inside of the thigh called gracilis, and the muscle that comes behind the thigh and inserts into the same area called semitendinosus. So what we're going to do is do a stretch of those three muscles. So the first thing we do is we invert the foot. So we hold the foot using the same hand as the person's foot. So in this case, it's the left foot, so I'm going to use my left hand. I grasp the heel in my hand and I hold the heel so the sole of the foot is roughly facing the midline of the body, so it's turned in. Okay, I hold the heel so it's maintained in that position, and I bend the knee and I bend the foot so both are at approximately 90 degrees. My other hand, my right hand, will just act as a stabilisation hand. It's not gripping hard, it's just stopping the knee going sideways. Now I have an arrow here because that's the direction we're going to twist the lower leg. So the foot remains in this inverted position and the knee is stabilised. So now I'm going to rotate the whole lower leg on the knee outwards to stretch these muscles. Now little people often don't understand the concept of discomfort. They understand pain or a situation where there is no pain. What we're doing here is a stretch, like if you stretched your calf muscle against a wall. So that's going to be uncomfortable, so that's what we're going to have this little person feel. So in doing so, like now, so I'm rotating it around, this little person may grimace, may whinge, and you count to 10 and relax. Now, if you do it and there's no grimacing and there's no whinging, as if the person can't feel it, then they probably aren't feeling it and you're probably not stretching it. So expect some whinging, expect some effect, like as if you were stretching your calf muscle out. But as soon as you release that pressure, you should also resolve any of the symptoms, so the person should come back to their normal happy self. Usually I recommend 1 to twice every nappy change, every day, each time for a count of 10. If you have any questions or any other concerns or issues, please either email or ring us so we can discuss your child's condition further. Thank you.